You're watching PCTV Channel 17, proudly serving the Port Clinton City School District community. The following is a production of the Port Clinton High School Digital Media class.
Welcome to Time for Health. I'm your host, Rachel Fall, and we're very glad you've joined us. We hope you gain something from the program that helps you and your loved ones. We want to arm everyone with as much information as possible so we can all make good choices. And this is not to take the place of regular medical care, so be sure to include your healthcare provider in on your plans and your conversations. And today our guest is Keri Brown, and we're talking about hand therapy.
Yes.
And honestly, I never even knew. I don't have too many problems with the hands yet, so I didn't even know this existed. So thanks for coming in.
You're welcome. Thank you for having me.
Sure thing. So hand therapy is kind of a specialty. You work in the therapy department. So what's involved in becoming a hand therapist? The training and stuff?
There are minimal requirements. First off, you have to be at least have 5 years of experience as a physical or an occupational therapist before you can even apply.
Okay.
And then 4,000 direct hours at minimum of direct patient care and hand therapy, working with the hand.
4,000 hours?
4,000 hours. And you have to pass the national exam, so which at the time that I applied was about a 55% pass rate. So, yes.
So I'm really glad you're here.
No kidding. So in 2013 is when I kind of started applying and getting everything around. I had 16 years of experience as an occupational therapist, so well over the 4,000 hours.
Yeah.
And I was concerned because I had been out of school for so long. So I had found a program at Drexel University. It was primarily an online program, so I could work full time. But there were 4 intensive lab weekends in Philadelphia, so hands-on experience, cadaver labs, anatomy, helped me remind. And they had a 99% pass rate.
Oh,
so
much better.
Yes. So that education was priceless. And I took the exam in November of 2014 and got my results and my credentials in December.
And here you are.
Here I am.
Okay. So intensive lab, you said cadavers and anatomy, like really looking at hands. Right.
Everything from the neck down to the hands.
Okay.
Labs as far as how to do testing on specific diagnoses so that you can kind of find out problems that the patients may have.
Okay. Yeah. So. And you keep saying hands-on, and that's funny. No pun intended.
Right.
So you just mentioned, I was going to say, is it only hands? And you just mentioned it's everything kind of from the neck or the shoulder down, because it's all connected.
Right. I'm primarily specializing in the elbow, forearm, wrist, and hand.
Okay.
Throughout my 18-year career now, physical therapy has always worked on the shoulder, so they are very they have very knowledgeable about the shoulder injuries, surgeries, things like that. I do, however, have a lot of expertise in neurological conditions like stroke patients, traumatic brain injuries, spinal cord injuries, where I would treat the entire upper extremity.
And are you said it could be a physical therapist or an occupational therapist. Are you also one of those?
I'm an occupational therapist. Yes.
Okay, good.
And 85% of CHTs or certified hand therapists are occupational therapists.
So I always used to kind of simplify it. I always used to say occupational therapy is like the waist up and physical therapy is the waist down, but not entirely.
Right.
But okay, so that makes sense. That most of them are occupational therapists. So, like I said, I don't typically yet have any troubles with my hands too much. So, but I know people who do, and it's really impairing. And so, talk about why it's so important to them.
Well, I mean, our hands are our livelihood. We use them to care for ourselves, to care for others, to work, to play, to communicate.
Yeah.
So any injury to the hand or arm can be devastating to our daily lives. And I think our society today wants the best. They want they want the best surgeons, the best physicians. So you want the best therapists. And a hand therapist specializes in the treatment of that. We know the research and all of the precautions and things that you have to have after a surgery.
Because I mean, if you think there's a particular door handle at the hospital that I always have trouble opening, and you never think, I don't really have trouble until I get to that door, and I'm like, oh my goodness, if I had trouble with my hands like this all the time,
Right.
like you said, we use it to, I have 3 little kids, I don't have time to have hand problems.
Exactly,
I can't
right.
do this.
Yeah.
So did you have some like aha moments when you were in training about like, oh, I never thought of that? Or
Oh yes, it was a very, very
that many hours.
Yes,
it probably
definitely.
Is.
I had been out of Ohio State for, again, 16 years. So going back, they really focused on evidence-based practice.
Gotcha.
The best available research, you know,
Okay.
the new surgeries, things like that, that I didn't know at the time.
Okay.
So there is so much information out there on what can help these patients and the best things that we can do. So
Gotcha.
that was definitely an aha moment, just to be able to see, rather than just, you know, being taught from your mentor because
Right.
that's what they thought was best.
Right.
You know, now
Really
it's,
looked at
yes,
the whole
exactly.
field of
Right.
everything. So some of the conditions I think that tend to run in my family. One of them is arthritis, and I know that's one of the things that you probably see a lot of when you're starting to deal with hand therapy.
Right.
What is that? Help.
Yeah. Well, there are different forms of arthritis. The
Okay.
most common is osteoarthritis,
Okay.
which is a degenerative disease.
Okay.
It breaks down the cartilage that cushions your joints.
Okay.
So when that breaks down, you get pain. And what we do is we try to teach joint protection techniques to these people to help them modify activities that they have to do throughout the day.
Okay.
You can use adaptive equipment, you know, and just using larger joints and things like that for arthritis. What we do in therapy is kind of manage the pain,
Okay.
teach different stretches. We can use splinting to help deformities,
Okay.
you know, just for support
Okay.
or for function.
Are those like things that they can wear at night? I think I've seen people, well, and that's maybe for carpal tunnel too, but
Yeah. Arthritis tends to be more problematic during activity, but if
Okay.
they do need something for rest at night, it could be just a nice functional positioning kind of a splint. The ones during the day are more for support if they do need to lift,
Right.
carry, things like that.
there's a joke about, you go to the doctor and says, it hurts when I do this. Well, don't do that. Well, that's not always the case with your hands.
Right.
I have to brush my teeth. and
Exactly,
I have
right.
to drive my car.
Yes.
Open the doors.
Right. So there's different ways to, if somebody has specific things that they have a problem with, we just kind of go over maybe some different ways to do that, or resting in between, kind of energy conservation, so that, obviously you still have to continue with your daily life and caring for yourself and others.
Right.
So we just want to find the best ways to do that for them.
Because arthritis isn't something that has a cure that can go away. It's once you
Right.
have it, it's going to kind of stick around. So you
Right.
need to preserve as much as you can.
Exactly. Teach them to manage the flare-ups when they do have a lot of pain, and then just promote joint mobility and exercise to kind of keep
Okay.
everything limbered up.
And I've talked with a number of other guests about different things. When you have arthritis and your hand hurts, you don't want to use it. But if you don't use it, it gets worse.
Right. The joints can get more stiff, and you actually have more
pain.
Right. And
So depending on what a person's condition is, or in the specific case of arthritis, if somebody comes in, you can kind of look and see, well, what kinds of functions do you need to do during the day? What is your job? What is your home responsibilities or your family responsibility? And you can kind of gauge what you need. It's not like, you have arthritis, you must do this.
Right.
You have carpal tunnel, you must do this.
definitely not a cookbook. Every person is different. A very helpful tool is a patient self-report measure,
Okay.
and they score themselves.
Okay.
They evaluate what they cannot do, what they're having the most problems with, and a lot of times that brings up other things. Well, it's turning the key in my car, and then So it brings up a lot of other specific things because people don't really think about it. Well, it just hurts all the time.
Right.
Well,
Is
let's
it all
think of
the
the
time?
specific
Yeah.
things that we can help to manage your pain.
Okay, so that is arthritis,
Right.
primarily. Okay, and some of the other things on there, therapy. I'm thinking of the flyer for an educational program you're doing. Conservative therapy, which is therapy to kind of prevent having to have surgery or
Right.
other invasive things, or if you have surgery, therapy afterwards. So
Right.
you can help with that kind of stuff too.
Yes, as far as arthritis, we do a lot of conservative treatment for that, but there are options for people like joint replacements and things like
Okay.
that, but it's pretty invasive,
Right. Can you do that on your
You can do
wrist,
that,
your elbow?
Yeah.
Okay,
They do a lot of
wow.
different surgeries. Yeah, but it's, you know, transferring tendons and removing bone, and it's
Awesome.
very difficult. Yeah.
So to prevent that, you can kind of do some hand therapy, or if you do have surgery, or to try to prevent that, you can do, and then if you do have surgery, maybe seeing a hand therapist in particular afterwards.
Right.
Or
right.
elbow or forearm or any kind of that.
Yeah,
any of that
just
stuff.
knowing the healing structures. You know, everything heals at a different rate.
Right.
So bones heal at a different rate, ligaments heal at a different rate, tendons heal at a different rate. So just knowing what the surgery was, what it entailed, and what
Gotcha.
structures were repaired. So
Gotcha.
that's where a hand therapist comes in, because they know all of that. And you want to safely progress the patient. You don't want to do anything that's going to harm the surgery,
Right.
obviously, or increase inflammation.
Gotcha.
So you
have to be careful.
Right, yeah. You need to know the precautions.
And some people are probably like, no, let's just get this going.
Right. And you know, no pain, no gain usually doesn't apply to hand therapy.
Okay.
So I like to tell my patients that, because they expect to just come in and have, you know, excruciating pain.
Yeah.
But the hand and the arm have very delicate structures.
Okay.
So overstretching or, you know, causing pain can actually increase the inflammation, and
Okay.
it will put you backwards.
And that's not where you want to go.
No. So people like to come and see us because we take away
Usually
their pain.
therapy, physical and otherwise, it is a little no pain, no gain, just a
Right.
little bit. But this is, you want to watch out for that, because
Exactly.
it's small, you know, smaller stuff.
Exactly.
It's not your big leg muscles or anything like
Right.
that. You talked about things healing at a different rate. It reminded me of a friend, and she broke one ankle and sprained the other, and she said I actually had more pain with the sprained ankle than the broken ankle. Is that what you're talking about? That certain
ligaments.
things,
Yeah, the ligaments during a sprain, they could take like 12 to 18 months to heal and get back to their
Wow.
normal strength. Where a bone break, especially if
Pretty
you know it's
clean.
surgically repaired,
Right.
then that could be like 6 to 8 weeks.
Okay.
Yeah.
So that explains that.
Exactly.
Wow. All right. All right, we're going to take a break, and we'll be right back to talk some more about hand therapy. And we're back talking about hand therapy. We talked a little bit about arthritis therapy, either as an option, trying to forego surgery, or once you've had surgery, doing some therapy afterwards. I know another big issue is carpal tunnel. Also have some family members with that. I don't know if it's genetic, but I see problems in my future.
Right.
So talk a little bit about carpal tunnel. What is it, and how can you work with it?
Okay. Well, the carpal tunnel is a very, very small space in the wrist, and it goes from about here to here. And what it is
That's
that,
it?
yeah, it's very, very small. So the base of the carpal tunnel is your wrist bones.
Okay.
And the top is a ligament.
Okay.
And what goes through there are 9 different tendons and the median nerve, and that's the one through the carpal
That's a
tunnel.
busy little spot right
It
there.
is. So any type of inflammation or pressure on that space can cause problems to that nerve.
Okay.
And what that is would be primarily, the first symptoms you would feel are numbness and tingling of the thumb, index, middle, and half of the ring finger. So those are the first sensations you would feel. So that's when conservative therapy could help. When you first start feeling those signs, we can teach joint protection techniques, some stretches, tendon and nerve gliding to help, you know, glide that nerve and the tendons through the carpal tunnel.
Okay.
Progressively, then you would start to have complete numbness.
Okay. Is this something that once it starts, it just kind of keeps progressing, or like once you feel numbness, if you can get some therapy, you might be able to prevent it?
Right, yes.
Okay.
The earlier the better,
Okay.
you know, as far as preventing the carpal
Anything
tunnel
worse.
at early signs.
Okay.
And then after the complete numbness, then you start getting weakness of the hand, and that's
That's
very,
the opening the jars and the door
Yes.
handles and that kind of
you know,
stuff.
atrophy of the different muscles and things like that.
Okay.
And a lot of times you can try the conservative treatment, but it's not as successful.
Okay.
And you may need surgery.
Okay.
And then after surgery, you could come to therapy for scar
Okay.
management, it's not a large scar, you know, just right here, and gliding and the different pain management, edema management, things like that.
And I actually saw a lady not too long ago. She was talking about how she had carpal tunnel, and you couldn't really tell anything, but when she held up her other hand, the atrophy, the muscle atrophy, because I don't know why, but it was really apparent when you compared it to her other hand. So that's something I just thought it was painful and kind of numb. And
that median nerve that goes, the only one that goes through that tunnel, it gives sensation to those fingers, but also to the large muscles of your thumb and your fingers. So that's why you get the weakness and the atrophy there.
And it does. Okay. And that's something that I've seen people wear splints at night.
Right.
Is that something?
Yes, because a lot of times I think we sleep like this.
We do.
So any type of flexion or extension at end ranges can create pressure on that carpal tunnel. So you really want to keep that wrist in neutral if you're sleeping, and those splints help to do that while you're
because you don't even realize it, and you're probably laying on it for a long period of time. Fractures and sprains and strains. I was talking about my friend with the ankle. You can help with that kind of stuff too?
Yes, usually obviously they'll see a physician or orthopedic surgeon first. And that's the surgeon and the doctor who tells us when we can start seeing the people. If it is an immobilization phase and they're casted, we could see them initially for range of motion of the uninvolved joints. Say it's a fracture of the wrist, you know, your shoulder, your elbow, sometimes people hold it like this, so then everything gets stiff. The fingers get swollen, they start to kind of go into almost a claw deformity, so we can kind of prevent some of that stuff during the immobilization phase.
So the doctor's like, don't move this, but make sure the rest of that other stuff doesn't have problems too.
Yeah, at least to get started, you know, and see maybe a couple of times until the cast is removed. Once the cast is removed, then we can start gentle motion, no strengthening until the doctor says that the fracture is well healed and able to take some resistance.
So there's these fine details of, when I'm thinking of therapy, you build strength, but probably not obviously right away. It's more just moving it.
Knowing the healing
is
structures.
Down the road.
Yes.
That's why you went through all that training. We don't have to know this. We just could come see you. Pain, generalized pain. I'm sure maybe there are things that people, it's not carpal tunnel, I didn't break anything, just pain. You can work with that too.
Yeah, and, you know, we do a comprehensive evaluation when it comes to pain because everything is connected. You know, the pain could be coming from a remote source like at the neck or the shoulder, you know, or even the elbow causing wrist pain. So we do a comprehensive eval, different screens for that. And if we can get someone to localize where the pain is, then I can do more of specific evaluations of palpations of the different structures that are in each zone of the wrist, or provocative testing, you know, which it's not the best because it's like, when I do this, does it cause pain? Yes.
Don't do that.
Yes. So, but that gives me an idea of what structure is involved. Is it a tendon? Is it a nerve? Is it a ligament? Is it a bone? And then,
so then that way, it doesn't matter what it's called. This is what's hurting, and this is how it hurts, and this is how we're gonna.
Exactly. Depending on the structure, we can guide our therapy to fix that specific structure and the symptoms.
Can, if it's not technically arthritis or carpal tunnel, it just hurts.
Exactly.
Well, let's figure out exactly where, and then just, I don't care what it's called. We'll make it feel better.
Yeah. Try.
That's pretty cool. Right.
And there are chronic pain syndromes too, like a complex regional pain syndrome, which I know is, and it is a disease and within itself, and that's usually from a referral from a pain management specialist. There's new research out there regarding graded motor imagery, which is pretty exciting. I mean, these people are in pain constantly. So there are 3 different phases that I won't go into right now, but there is, you know, some hope and some help hopefully in the future for some of these patients.
One of the most recent guests we had on here was Dr. Nabavagadi from Pain Management, and that's what he was talking about some of these things too. So, yep, we all work together. Injuries. We talked about sprains and strains and fractures, but there's other kinds of injuries.
There are
lawnmowers and
complex hand injuries where lacerations of tendons, crush injuries from work, like in presses and things like that. So you have that's again where a certified hand therapist is probably crucial, because knowing the specific structures involved in the different healing And if you do something wrong, you can
cause permanent
rupture the tendons of the repair and things like that. So that's something definitely I would recommend. If somebody has a complex hand injury, you want to seek out a certified hand therapist.
Okay. What are some other crushes, big lacerations? Like I'm thinking of lawnmowers and chainsaws. And
well, even just I had somebody using a X-Acto knife and they cut the tendon of their thumb because it slipped, or a stab because they were trying to cut a kiwi or a papaya.
Gotcha. Oh yeah.
And they lacerated a tendon just from a small little puncture wound. And that's a major problem, because then the finger, the connection is gone, so it has to be repaired by a special hand specialist.
Goodness.
Yeah.
I think I'm going to hire somebody to cut my fruit now.
Watch those knives.
All right. So those are some of the more common reasons that people might come see a hand therapist. How do they go about the process? Do they come right to therapy at the hospital? Do they work with their family physician?
They would need to have a prescription, much like a medication prescription. They would need that from their doctor. A lot of times, if they've seen a physician within the last 30 days, they can call the physician and say, maybe they mentioned that their wrist was bothering them but didn't want to do anything at that time. They could say, it is still bothering me. What do you think about, possibly trying some hand therapy? So yes, they do need a prescription from a physician. It could be their family physician, a specialist they may be seeing, a rheumatologist. And then they would call the hospital and they would get the insurance information, get pre-approved, make sure everything's covered. Nobody wants to pay out of pocket.
That's a whole other episode.
Yes, exactly. And then we would schedule an appointment for a first evaluation.
So working with the physicians, you said either a family physician, pain management, surgeons, you all work together.
Right.
So you're not going to hurt anybody's feelings.
No. No, and with the complex surgeries and that, I often get a surgery report so that I can actually read what was done, what structures were repaired and things like that. So they will send me that. If I ever have any questions, they are very helpful as far as answering, could I do
is it motion time, or can we start building strength?
Right. Yeah, and family physicians, I've had some of the physicians call and say, I need this person in tomorrow.
Gotcha.
And, because some are more emergent than others. It's not like I'm in an emergency room and there's bleeding involved. But, if somebody needs a splint right away, then it needs to be done. So they can call me and I can maneuver my schedule to be able to fit them in. Okay,
so starting with their physician, whether it's their specialist or whatever.
Right.
Starting there to come in, and you guys take it from there.
That's right.
All right. Now, prevention. Some of these things, like the arthritis, osteoarthritis, is just kind of a wear and tear, and some of these other things. What are some things we could maybe do, not that we don't want to concede, to prevent some of these chronic conditions and that kind of stuff?
I would say the main thing for us, we do a lot of education. We are literally teachers. We teach people how to prevent these injuries or how to manage them. So the main thing I think of off the top of my head is like joint protection techniques. Just, the hand has very small joints. We need to respect the pain. If there is an activity that is causing you pain, we need to modify it. Like you said, we don't want to
doing
it. Right. So respect the pain. Let's find out how to make things a little bit easier for you. Distribute the load over larger joints instead of picking something up with maybe the thumb or the fingers. Use your entire palms or the under parts of your hand. Carry things on your forearm rather than in your hand. Right.
Grocery bags.
Exactly.
And that kind of stuff,
because the ligaments is what connect bone to bone. And as you stress those, they can get stretched and worn out, and they are very, very delicate. For instance, with arthritis, 1 pound of pressure at the tip of the thumb, say if you're pinching, equals 12 times the force at the base of the thumb. So that is why that is a very susceptible joint to pain and arthritis. So we want to teach people to use their entire hand or their arm rather than constant pinching with the thumb.
What A couple things just came to mind about prevention, like when people are exercising and they're doing push-ups. Not that I'm trying to get out of doing push-ups, but there's adaptive equipment. I'm thinking of adaptive equipment. You know, I have to open jars, so there's adaptive equipment to open jars. Is there adaptive equipment to do some of that stuff without?
Yeah, you can use dumbbells and have your wrist in a neutral position and do push-ups, so you're not off the hook. You need to put those dumbbells on the floor.
So putting things, distributing the load, and kind of protecting things, not being afraid to use adaptive equipment, that kind of stuff. Those little gripper things to open the jars.
Exactly. Good body mechanics, you know, keeping your back and everything straight. Like I said, everything's connected, so if you throw your back off, your postures, bad. And just simplifying things. If, you know, especially people with arthritis, they can't get up in the morning, take their shower, get dressed, make breakfast, and start cleaning the house.
Right.
You know, they need to pace themselves. Energy conservation. Take breaks, you know, just to kind of plan activities and plan the breaks in between there too. Okay. And then just general aerobic and strengthening, you know.
Keep moving.
Yes, keep moving. You know, nerves are very oxygen and bloodthirsty, so light aerobic exercise can help with all the nerves in your body, you know, just carpal tunnel and things like that. Not smoking, not drinking. Those are like global tactics because that can decrease the oxygenation to the nerves. Yeah.
Who knew exercise was, or aerobic exercise had anything to do with your hands? But it's all connected, isn't it?
And strengthening is very important for bones.
Yes. Yes. It kind of reinforces all that kind of stuff inside. All right. Any other tips?
Let's see.
We cover?
I think so. I think we covered most of that.
All right, good deal. Well, thank you very much.
Oh, you're welcome.
All right, we're going to take another break and we'll be right back. Thank Keri for being our guest today, talking about hand therapy. Did not realize all that is involved with the hands and the wrists and the arms. So very, very enlightening. Lots of ideas for prevention and protecting your hands and doing things smart. And then if there's a problem, what you can do after that. And as always, like I say in the beginning of the show, and she reiterated, talking to your physician first, whether it's a surgeon or a pain specialist or your family physician, talking with them first. You can reach the therapy department at the hospital. Their number is 419-734-3131, and then their extension is 3475. So that's how you can reach them if you have questions. So hopefully you learned something helpful like I did today. If you ever have feedback about a program or a suggestion for a future episode, please let us know by sending a note to Time for Health, 615 Fulton Street, Port Clinton, Ohio, 43452, or you can email Carla Pelz at the high school, cpelz@pccsd-k12.net. So think about something you learned today, whether it's for you or for someone that you know and love. Share the information, and until we meet again, I encourage you to make time for health.